A measles outbreak has infected at least 124 people in Texas, most of them children. One child has died. The child was unvaccinated, and according to the CDC, this is the first time that a U.S. measles death has happened here on our territory in a decade. Joining us right now is former FDA Commissioner Dr. Scott Gottlieb. He's a CNBC contributor who's also on the boards of both Pfizer and Illumina. And Dr. Gottlieb, let's walk through this outbreak in Texas. How concerning is it at this point? There have been people who have been trying to figure out whether they're going to take trips to Texas at this point. Texas is trying to raise alerts and awareness, but is also trying to make sure people don't cancel spring break trips going there. What's your take?
Yeah, look, I think that they're a long way from reducing this. This is a fairly large outbreak at this point. There's 125 cases. There's been a case diagnosed late yesterday in San Antonio, so it does seem to be seeding other parts of the state potentially. And this could take a long time to get under control. It's isolated in this particular community in West Texas where vaccination rates are low. It's a Mennonite community, but it does appear to have spread outside that community. And what you worry about right now is that you're going to start to see cases seeded around the country. Remember, in 2019, we had a very large outbreak, upwards of 1,000 cases, isolated in mostly in the Orthodox Jewish community here in New York City. That took a long time to get under control, and they were very aggressive with trying to vaccinate people. I think right now the local public health officials are doing a good job in Texas, but this is going to take some time.
Yeah, I was reading yesterday that the incubation period is a couple of weeks for measles, which is why the numbers you're seeing right now are not going to be the final numbers, that it's quite a bit bigger than we're seeing on the headlines.
Right. And people aren't, the discussion on the ground is that a lot of people, or some people, it's hard to get a handle on the numbers, aren't presenting if the children aren't very sick. So there's a belief that the numbers are much larger than what's being officially reported. Remember, I was on this show probably 3 weeks ago now. We were talking about this particular outbreak, maybe a little bit longer than that. And I said that they would get control of it within a couple of dozen cases. I said that because I had been talking to some CDC officials at that time who felt that they were able to get control of this outbreak. So clearly it's spread beyond what the initial expectations were. And I think that's concerning as well.
There was a new measles case in Bergen County, New Jersey yesterday as well. It's unrelated. It's a separate situation. A child who traveled internationally came back and infected, I believe, a couple other close family members. There are measles outbreaks every year. Is this different? Is this more concerning? Is this broader?
Yeah, it's larger. Typically what you see is isolated measles outbreaks where someone does import it into the country as a result of foreign travel. In fact, we saw a case in Kentucky as well yesterday. That also seems to be related to foreign travel. Typically those cases would be snuffed out after perhaps a handful of transmissions because vaccination rates are typically high. This is a much larger outbreak, and it's concentrated in a community that does travel. So the concern would be that it gets seeded into other pockets of relatively low vaccination rates. And remember, vaccination rates have been declining around the country. So there are states with overall low vaccination rates, Idaho around 79%, Alaska 84%. And when you think about the states with low vaccination rates, within those states, there's obviously pockets of even lower vaccination. It's not like it's an average spread across the country where you have specific communities that have low vaccination rates. So when it gets into those communities, you can have the potential for an outbreak. And that would be the concern right now, that against the backdrop of declining vaccination rates around the country, you start to see this spread into other pockets where it can continue to spread because you have these communities that have foregone vaccination in large enough numbers. Remember, this is a vaccine that after one dose is 93% effective, after two doses 97% effective at preventing people from contracting measles. But if you're unvaccinated and you come into contact with measles, you have a 90% chance of getting infected. This is one of the most contagious viruses that we know. So if you do get people traveling who are infected and you into a community with low vaccination rates, there's going to be spread within that community.
Scott, I know we want to cover a lot of things, but every couple of days I read about the possibility of another virus, maybe even another coronavirus. And do you know are there new safety protocols at that Wuhan lab? And I don't want to just talk about that lab. There's research going on around the world. It happened once. Was that a very low problem? If it did happen once, and we still argue about it, but if it did happen once, an escape from a lab, Was that a complete fluke and low probability event, or are we looking at the possibility of something happening again with a much higher mortality rate?
Yeah, look, you touched on something that's really concerning. There was that study published in the journal Cell about a week ago that the scientists in the Wuhan lab, that Wuhan Institute of Virology, have isolated a new coronavirus that has a lot of concerning features. If you read that Cell article, they were experimenting with that virus in a BSL-2 lab. They should not be doing that. We should have learned our lesson. Experimentation with novel coronaviruses should be done in BSL-3 and BSL-4 labs, higher security labs. They still haven't taken those precautions according to their own paper that they published.
That's like a P2 lab?
Yes. And
okay.
you know what you've
That's
also
what
seen is a
I have an
proliferation
article
of
in Cell. I have an article published in Cell. I do. It's a great journal.
Congratulations.
Thank you. It's a great journal, by the way. But it's so they're doing it in a P2 lab. That's great. That's nothing in terms of the
that's
level
right.
of
It's a very low
containment.
level of precautions, yes. And the other thing you've seen is a proliferation of BSL-4 labs around the world because every country felt that they needed to build their own high-security labs. And now high-risk experimentation is getting outsourced to those labs because people aren't allowed to do it in Western markets. And so there's a lot of reason to be concerned that there's more high-risk experimentation going on, sometimes in places with low level of precautions, and sometimes in places that have high-security labs but don't maintain them well. And so this is an area of significant concern.
Hey, Scott, separately, I just want to understand the broader issue here with measles piece and vaccines broadly. Do you think that this is a psychological question, I guess, or a behavioral science question? If enough people get measles, do you think it will change the national conversation around vaccines?
Well, we do see it changing the conversation around measles. And so when you have a measles outbreak, you do see vaccination rates for measles, the MMR vaccine, rates of uptake going up. Unfortunately, I don't want to see outbreaks that instigate people to take what I think are appropriate actions, getting their children vaccinated. Yeah, no, I know you're not. Right. I don't think so, is the answer to your question. I mean, I hope it doesn't come to that, but I don't think so. I think it's going to take more than that, because a lot of these anti-vax sentiments right now are pretty ingrained. People are identifying with them based on their political persuasion as well. So I think that this is a generational change, unfortunately.
And let's ask you that. How would that play out then, generationally? Meaning, if people really don't take these vaccines, what happens?
You start to see more outbreaks of infectious disease. And you're right, there'll be some compensatory behavior. As outbreaks happen, people will go get vaccinated. But I don't think it's going to change the underlying psychology. This is going to be a longer effort on the part of public health officials. And as you know, a lot of this is coming out of COVID. I think the mandates had a lot to do with this, or something to do with it. People felt that, public health was overbearing, forced them to make decisions that they didn't want to make, that was against their own beliefs. And I think you're seeing a backlash. That we talked about this many times on the show, and specifically about the mandates that, at the time I felt they were a bridge too far and would instigate an anti-vax backlash. I think we're partially seeing that. And this is going to take a longer time to re-educate people and try to,
Scott, are you getting a COVID shot every year now?
To get vaccinated.
Would you get a COVID shot every year now? You do? Okay.
Yeah, I do, and I get it with my flu vaccine. So I view it the same way. I view it through the same lens that I view getting a flu vaccine each year.
Okay.